This is my reflection on my postpartum / newborn teaching that I did with my patients in the hospital. I addressed lochia to her, so also known as bleeding. I talked about the different stages that she would experience. So I told her that the first 1 to 4 days is normally a red color, like she would experience if she was on her period. And that only happens the first couple of days, and then she will notice a transition from like the third or fourth day up to the 10th day, which she'll see more of like a pinky brown color, that it would be more like the end of her period. And then it goes back to normal. So like the 10th to the 14th day, she'll see the bleeding go to like a white to a yellow color, and that she doesn't want to see any clots the size of like a golf ball during this period of time, because if she notices anything like that, that it could be a sign of her hemorrhaging, or that there's possibly more of the placenta in her uterus that was not removed afterward. And that if she experiences like any dizziness or headaches when she gets up, like in the very beginning of this bleeding, so more like usually right after delivery, because that could also be another sign that she's hemorrhaging and she doesn't know it. And then let's just say she goes home, and after a while that her bleeding picks back up, it could be a sign that she's working too hard and that she needs to relax. Another thing that I addressed was her episiotomy. So she did deliver vaginally and she did have to have an episiotomy. It was just a first degree, but I just wanted her to know that she should keep an eye out for like redness and swelling and bruising. And those are normal things that occur, and that she could use an ice pack, which is normally probably going to be her best friend for the first couple of days or even first couple of hours, depending on how bad her pain is. And that there are other like medications she could do, like a spray or a peri bottle, which is more of like a numbing cream or numbing spray that she can use for down there to kind of numb it, so that when she goes and sits back down in her bed, that she won't be super uncomfortable. Or I know there's like witch hazel pads that she can use, which also helps with that. And when just discussing both of these things with her, she was very understanding, and you could tell that she was very intrigued. And she would ask, and she would kind of repeat things back to me like, okay, so I'll see some redness or bruising, right? So I knew that she was paying attention to what I was explaining to her, and she was actually listening, and that if she had any questions, she could ask me. Another thing that I addressed with her was, because it was her first kid, that there may be a chance that she was going to experience like postpartum blues, which I told her was totally normal and is something that she possibly could experience because of the decline of her hormones that came down so fast. And that's something totally normal to experience, and it's something that she shouldn't be embarrassed about, and that if she does go through this, that she should come to us and talk to us about it, and talk to her spouse, because it's really important to have a support system behind her, and to watch out for how long it lasts. Because if it lasts longer than 2 weeks, that it is postpartum depression, which then can be super serious, and it's something that she should report to her doctor and get treatment for. Because it could be she could be in danger to herself and her child, and it could last longer, and nobody wants to be depressed like that. And so it's something that she shouldn't feel ashamed about, and that she should go talk to her doctor too if it lasts longer than 14 days. But if it doesn't, and she just has normal postpartum blues, it's totally normal, and that it should go away in a few days once her hormones kind of level out and settle down a little bit. And then along with that it's important to do skin to skin contact with the baby. It promotes positive bonding, and creates a like that bond between the mother and the baby. Not only helps with like breastfeeding and all of that, and to show that like you may look at this baby and you cry, but that's okay. You know that you love the baby. You're still holding it and calling the baby by her name. That is something that's totally normal, and that is positive bonding. And with this, she asked and gave a couple other scenarios like, oh, if I like sit here and cuddle with my baby and the baby sleeps with me, is that okay? Is that something that would be positive bonding? And that's something that I noticed she was intrigued into the conversation that we were having. Next, I talked about her fundus and the way it should feel. So I palpated it for her and felt the firmness. And so I let her feel her own fundus so she knew what it was supposed to feel like. So then I further told her if it was boggy or if it was soft, this is something that you don't want. And if it is like that, it's okay. Just give it a little massage and then it should tighten up right away. But don't massage it for too long because that's when like the fundus relaxes, and that's something that you don't want. But you want your uterus to be contracted, to go back to its original shape. You don't want all that extra. If something was going on, you don't want it to be able to, more likely for her to have like a hemorrhage or something like that. And then next I talked about breastfeeding because my patient was breastfeeding. And so I wanted to inform her about latching, how the baby should latch, and look like for any signs of like redness or bruising or cracking and pain and stuff like that when breastfeeding, because this could be a sign that the baby isn't latching correctly. So let's say that she had like an everted nipple, which is the best kind of nipple to have when you're breastfeeding. The baby could just suck at the very tip of it, which is causing her pain and discomfort. And that the baby isn't latching right, because when you're breastfeeding, in a sense, you don't want just the nipple, you want like the whole breast. So you want to make sure that the baby's mouth is going around like the whole areola instead of just the tip of the nipple. And I told her that if she is having any cracking, instead of putting like a ointment on it or anything, that her breast milk actually is a awesome natural healer to that, and it's something that won't harm the baby, and the baby's already drinking it, and it heals. There's a lot of healing properties to it, so she just put that right around the nipple where it's cracked, and it will totally heal up the baby, or heal the nipple area. And my patient was actually very shocked when I told her that, and it was something that she didn't even know. And so it was pretty awesome that I was able to tell her stuff like that. And so that was my assessment that I did with my patient, and gave her some not discharge teaching, but some teaching that she can take with her when she was in the hospital and then when she is discharged about herself and her baby.